Okay, so hello everyone. So now in this video we're actually going to, James is going to demonstrate actually doing the suturing. So we're going to be doing interrupted sutures for this video. My hand is here just because the mannequin moves a bit and I'm just holding the mannequin steady. Obviously you wouldn't normally need to do that.
Okay, so we now take our suture material that's appropriate for the type of wound and the anatomical location, and it's very important that we grasp the needle on the last third of the shaft of the needle so that we're not damaging the cutting edge and the cutting blade that's actually going to enter the patient's skin. If we need to manipulate any of the tissue or actually just expose the wound so that we can get a better visualisation of it, then we must use the toothed forceps because they allow us to move tissue without lots of blunt crushing pressure. You have got some non-toothed forceps if you needed perhaps in an earlier stage to remove any pieces of grit or glass or jean material or glass, whatever's in the wound. I always get an itchy nose when you can't touch it.
As soon as the gloves are on.
Yeah. So I've got this needle now mounted onto the needle holder. I've got the locking mechanism actually doing all of the work, so my fingers can be fairly relaxed. I'm just supporting the instrument with my index finger just to give it some stability. Now, in a wound like this, we've already assessed it, neurovascular compromise, and we're happy. We've irrigated it, we've cleaned it, we've done some imaging if need be. We're now going to just look to close it with a suture. And we're always going to start in the centre of the wound, because if we start at one end and try and zipper it up, like you can imagine a zip would do, you pull the zip, it kind of closes it behind it moving forwards. You can often end up with a little an uneven match as you come to the end part of the closure, and that is cosmetically very bad and gives a very unsightly and unpleasant scar potential.
So one scar on my arm actually, which I can show you, which is exactly
what I think. Put that first stitch in, and we're going to go in the centre of the wound so that we bring the edges together quite nicely. So we're going to actually look to just enter and then rotate so that the needle is near to the bottom of the wound bed. Good job for that local anaesthetic. That's the beauty of the local, it will mean that the patient won't feel any of this. Okay, so I've brought the needle through to the bottom of the margin of the wound. Leave an appropriate length of thread. And then we're going to just start at the bottom of the wound margin and bring the needle up. That's brilliant. Disengage that. Now obviously if we start to tie the knot here, we're going to get one or two sutures out of this piece of thread, which is very wasteful and completely unnecessary. If I have too small a tail, then that's going to make it very, very difficult for me to tie the knot, and I run the risk of the suture popping open because I haven't tied it correctly. So you want to leave kind of a decent amount of length that's going to allow you to tie the knot, but not be too wasteful nor be too small. So I'll leave a couple of inches there. I'm going to hold the needle steady in my hand, and now I'm going to roll the thread over the tools once and roll them over a second time, and then I'm going to grab the tip of the tail of that thread and then just slide the thread off, and we're going to just apply a little bit of tension onto that line, onto the suture material. So that was my two rolls forwards, and now I'm going to give one roll backwards, so the other way, and then grab the tip of the tail and then slide off. So that's going to where we're really going to look to lock the tension on the knot at that point. So if we want to adjust it, that's the point to do it. And then the next step is two throws of the thread forward, and this is a bit like doing the double shoelace when you're at primary school, so that it doesn't come, the lovely bow doesn't come undone at break time when your parents aren't around to tie it for you.
I still do that.
It's all Velcro. Yeah. So one roll forward, two roll forward, grab the tip of the tail, and then slide off. And what we've got is the knot has formed at one side or the other side of the wound. We do not want the knot to be overlying the wound itself, because that's going to impact on the cosmetic healing. So we always want the knot to be one side or the other, and it's just conventional to keep them all the same side so that they look nice and neat. So at that point, we're now going to hold both pieces of thread together so that we are able to cut the thread in one manoeuvre. That gives you nice, neat tails. And we can just discard with that little piece of thread. So that's our first suture in the centre of the wound. And I think looking at this wound here, I think it's probably going to take 3 sutures in total to hold it together. The wound edges have come together quite nicely so that we know that we've got nice levelling up in both directions with the tissue, but I think we've just got a little bit of gaping here and a little bit more gaping there that we need to just bring that together. So I'm going to reload my needle into the needle holder, and with this one I'm going to just enter and go to the bottom of the wound. Yeah, that's nicely. Get the tools to lock right now. Make sure we've got an adequate length through our tail. And then I'm going to actually just change the way I hold it. Start at the bottom to the very top. So we've got the thread down to the bottom and then up, and now it's a case of doing 1, 2 throws forward, grabbing the tip of the tail and getting some tension onto that wound. Now we're going to lock it 1 roll back, grab the tip of the tail, and this is where that second throw we're now locking the tension, and now the third set of throws is now doing our double knot in effect. So 1 throw forward, 2 throw forward, grab the tip of the tail, and now that's our knot. So we're going to keep that together, keep those threads together, cut them. So now we've got the wound that is looking very nicely from the centre towards myself, and we've now just got to do 1 more suture. I think we've got a little bit of gaping of that wound still just open, so we want to make sure that's sorted.
So we'll do that as a close-up so you can see that not clearly. Once you've got the sutures into the patient, it's important to obviously apply dressing over the top of the wound, much like we've done with the previous videos, and then we need to give them some very clear advice about how to manage their sutures. The advice does depend on the sutures and where the location of the wound is, but it's generally, as it is with all wounds, keep the wound clean, keep the wound dry, and then when to return to have their sutures removed, and we'll show you suture removal on a different video. Is there anything else to say?
No, it's always good to let patients know how many sutures you've got. If they're big sutures in somewhere like a leg or an arm, that's not too much of an issue. But if you start getting the very fine sutures, perhaps on the face or the bridge of the nose or around the eye, the material is so fine that it can be easy to miss them when it comes to taking them out. So if your practice nurse knows that you've got 17 sutures to remove, then they can have a good look around and make sure they've got all 17 out. If you're not quite sure how many, it's possible that they might miss 1 or 2 or 3, and then that can go on to cause a problem with infection, because the material, once the wound healing has taken place, the material does need to come out. These are not absorbable sutures, so they're not the sutures that we would leave in place. And the other top tip is to just remind people that this is the beginning of wound healing, and it's going to take many weeks, if not longer, for the actual tensile strength of that tissue to be repaired. So, it isn't unheard of that perhaps if a keen sportsman or a bodybuilder or weightlifter, were to have some sutures placed on their arm, a couple of days after the sutures are out, they might want to be out pumping iron again, and the absolute forces that they would apply to the wound would mean that the wound could actually burst open again. So it's important to remember that once the wound has healed, it takes much longer for that tensile strength to build for full repair. So you just need to be a little bit careful with your advice that you give.
Okay, thank you very much.